To Dr. Mensch, the radio show that takes a real, compassionate look at mental health from A to Z. Join child and adolescent psychiatrist Dr. Gil Lichtshine each week as we explore topics that matter: autism, ADHD, anxiety, depression, OCD, schizophrenia, behavioral challenges, neurodevelopmental disorders, and more. No stigma, no judgment. Just honest conversations, new therapies, breakthrough treatments, and real solutions for real people. Mental health is not a weakness. It's a treatable medical condition, and help is available. Join the conversation now by calling the studio at 888-994-4995, Studio A. This is Dr. Mensch, where hope and healing begin.
Good afternoon, everybody. My name is Dr. Gil Lichtshine, aka Dr. Mensch. I'm a board-certified child, adolescent, and adult psychiatrist in Boca Raton, Florida, where my office is located at 7100 West Camino Real, Suite 404 in Boca. My phone number 561-300-4052. Hope everybody's had a good weekend and a good last week. Some big news. Well, I guess you could say maybe I thought it was big news, but some news from the White House over the weekend. I know there's been a lot of news from the White House over these past few weeks. There's a conflict going on in Iran, but on Saturday, President Trump signed an executive order to fast track or expedite research and potentially get FDA approval for a particular psychedelic, I don't want to call drug, but psychedelic agent called ibogaine. They were specifically talking about ibogaine, and in the meeting in the Oval Office, he had Marty Makary, head of the FDA, I think Robert Kennedy, the head of Health and Human Services, Dr. Oz, who's the head of Medicare, Joe Rogan, some military veterans. The reason being is ibogaine, a psychedelic drug, has been studied in the use in treating post-traumatic stress disorder, and as it is not available in the United States, a lot of patients who are suffering from PTSD, such as military veterans and others, have gone to other countries to seek the treatment, specifically Mexico. I have some familiarity in having done lectures on other psychedelics, specifically MDMA or ecstasy, and psilocybin, or people call them shrooms, magic mushrooms. Similarly, and to a lesser extent, ayahuasca or dimethyltryptamine or DMT. Ibogaine is a psychedelic that I have some familiarity with, but there's been a lot more published data, what would be considered like placebo-controlled or randomized controlled trials with ayahuasca, with ecstasy. There's been one with ayahuasca and quite a few with psilocybin. So I'm going to focus on those more than ibogaine. But if anything, President Trump's executive order is kind of highlighting or emphasizing these type of, I'm going to use the word drugs, euphemistically or in quotations, but these medications that people think could be dangerous or lethal or toxic are actually can be very therapeutic when used in the appropriate clinical settings, and that's the key thing. So, like I said, I'm not as familiar with the data with ibogaine, but I'm more familiar with the literature pertaining to MDMA and psilocybin. So, actually, MDMA, or again colloquially known as ecstasy, is what's called an empathogen. It's a class of I use the word again, drugs, that the effects of taking these drugs make people more empathic, more social, kind of more emotionally engaging. Psychedelics as a whole, and again, the term psychedelics is more of a term used for any type of drug that kind of enhances one's perception, cognition, and mood. And it's a general term to apply to a whole different class of drugs. And psychedelics can include, is it MDMA, which is a empathogen, psilocybin, which is hallucinogen, and in that class includes LSD and DMT or ayahuasca. And then there's the dissociates, such as ketamine. And all these type of psychedelics have different mechanisms of action and different kind of clinical effects. So ketamine, which is FDA, discussed ketamine a few weeks ago. Ketamine in nasal spray is FDA approved under a brand form called Spravato or S-ketamine, and as a dissociate, it kind of causes these like out-of-body experiences. Hallucinogens such as DMT, psilocybin, LSD, kind of cause a lot of changes in perception, and empathogens such as MDMA kind of cause individuals to kind of feel more connected and more empathic towards each other. These different psychedelics have different clinical applications. Ketamine is FDA cleared or approved to treat treatment-resistant depression and depression with suicidal ideation. There's other data of ketamine being used to treat various substance use disorders, bipolar disorder, even PTSD, and OCD. Ibogaine, I mentioned before, some data with PTSD. MDMA, the main studies with MDMA is for PTSD, and with psilocybin has been with treatment-resistant depression. And again, these drugs have different mechanisms of action. MDMA, has been studied for quite some time, and a lot of the preliminary studies, and actually a pharmaceutical company named Lykos actually presented an MDMA capsule to the FDA back in the summer of 2024, but the FDA, with all its political BS, and the FDA really is a real a political organization. And this was during the last administration, which, from my understanding, didn't really push advancements in psychedelic treatment. They rejected this MDMA pill, citing that there was not enough safety data. And in the, I believe, 2 or 3 publications of phase 3 trials with MDMA, it showed that that MDMA was very, very safe and really had very few significant adverse effects. Now, what MDMA has shown that it really, I don't want to say cured PTSD, but that in a short treatment window, that significant percentage of patients in these studies, we're talking about almost like 2/3 or maybe even close to 3/4, didn't meet criteria for PTSD. And that's pretty phenomenal, because right now, there is really no effective pharmacological treatment for PTSD. If someone asked me what's the best treatment approach, I would say really more like trauma-focused cognitive behavioral therapy, or a type of therapy called eye movement desensitization and reprocessing, or EMDR. Those are probably the most proven treatments. So we're talking non-pharmacological treatments. But a lot of times patients with PTSD often have comorbid conditions, substance use disorders, mood disorders such as depression, bipolar disorder, and so a lot of the pharmacology that's being used right now is a lot to treat kind of these comorbid. So it's not uncommon for patients with PTSD to be on SSRIs like Lexapro or Prozac to treat depression or other anxiety disorders, mood stabilizers such as lithium or divalproex or Depakote to treat mood instability, antipsychotics to treat mood instability, anxiety, mood, nightmares. There's a blood pressure pill called prazosin that has shown to have some clinical usefulness in treating the nightmares. But, unfortunately, there is no like one medication out there that can kind of treat like the constellation of symptoms that, patients with PTSD have, such as avoidance, hypervigilance, traumatic, intrusive recollections of the event, a lot of autonomic instability. But along comes MDMA or ecstasy, and it's shown to really, treat, PTSD effectively. But the key thing with the studies with MDMA, and when I've given lectures on it, is I emphasize that MDMA, it's not like I will prescribe or send an electronic prescription to Publix or CVS or Walmart and say, okay, take one MDMA pill a day and come back and see me a month. That in the studies with MDMA, this has always been kind of associated with or given in the context of intensive psychotherapy, what's called MDMA-assisted therapy. And this is not just simply going to a therapist's office for 30 minutes or an hour and talk about your problem. We're talking that they would entail 2 or 3 preparatory sessions to explain to the patient what to expect. Then you'd have a medication session where you would administer the MDMA to the patient, and then they would have maybe 1, 2, or 3 medication sessions in the course of a week or over the course of a couple weeks, and that would be followed by 6 to 8 hours of intensive psychotherapy. And the idea is that the MDMA kind of opens up the mind, and so it allows the patient to kind of have like this open kind of sense of openness that would allow them to have less kind of barriers to repress or not talk about these traumatic events. And so the MDMA kind of is like some sort of like channel or bridge to allow a patient to start talking about their traumatic events, and the therapy can kind of help them not kind of get panicked by it. And then after these like medication sessions, you'd have several integration sessions where the therapist would help the patient kind of integrate what they've discussed so they can kind of maintain whatever gains they've made. So MDMA, prescribing MDMA, giving MDMA, and the assisted therapy, this is a pretty intensive treatment. So it's not like take a Prozac a day and come back in a month. So I always like tell patients, and when I give lectures, how that the studies are that MDMA is really along with intensive therapy. But nonetheless, the data has been very promising in showing that MDMA, again, it's not a cure, but probably more effective than any pharmacological therapy we have right now. And on that note, I'm going to take a brief commercial break, and we'll be back in a minute. Thank you.
What happens when the mind of a healer crosses over into the darkness of the human soul? From authors David Icovetti, Dr. Gil Lichtshine, and Yolanda DeLuca comes a chilling psychological thriller, Dr. Mensch, A Prescription for Evil. This gripping novel follows a respected Boca Raton psychiatrist who secretly descends into madness, transforming into a modern-day king of the underworld. Inspired by true events and Dr. Gil's childhood connection to a mob family, this story blurs the line between sanity and evil, genius and destruction. Unforgettable, disturbing, impossible to put down. Get your copy today on Amazon.com. Dr. Mensch, A Prescription for Evil, a 2020 psychological crime thriller. You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshine. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show.
Welcome back. I'm Dr. Gil Lichtshine, aka Dr. Mensch. For those who've missed it, I'm a board-certified child and adolescent and adult psychiatrist with my office in Boca Raton at 7100 West Camino Real, Suite 404. And my phone number is 561-300-4052. I'm continuing my discussion on psychedelics, given President Trump signing an executive order over the weekend to try to kind of fast track and really focus on promoting and getting psychedelics FDA approved. He was specifically talking about ibogaine for PTSD. I talked first about MDMA for PTSD because there's a lot of good data on how effective it is. And it's really a shame that the FDA denied it. And I'm hoping now with President Trump's executive order that perhaps that pharmaceutical company can resubmit any additional data to show that MDMA is effective and safe and very tolerable. The other psychedelic drug that has shown a lot of promise and psilocybin, which is a hallucinogen that's commonly found in selected mushrooms called magic mushrooms. And as the name implies, psilocybin along with DMT or ayahuasca and LSD kind of cause altered perceptions. And the thought is that psilocybin works by binding to specific serotonin receptors, promotes the release of serotonin, and it binds to a particular. It's an agonist of a specific serotonin receptor, the 5-HT2A receptor, and that when psilocybin binds to this 5-HT2A receptor, it actually causes like a downstream and cascade of effects to include the production of something called brain-derived neurotropic factor, BDNF, which promotes neuronal growth or neuroplasticity, and also has effects on the NMDA receptor and promotes the release of glutamate, which is an excitatory neurotransmitter. So there's data that shows that hallucinogens like psilocybin actually can promote neuronal growth, and that it's actually not like detrimental necessarily or cause brain damage. But psilocybin is actually, the focus on psilocybin studies have been on treatment-resistant depression. There's the studies with psilocybin, again, have all been in kind of conjunction with psilocybin-assisted therapy. But there's been some studies kind of looking at comparing doses of psilocybin with one another to seeing what optimal dose. And there was one or two studies that were comparing a 10 milligram dose with a 1 milligram dose and a 25 milligram dose, and the data showed that the 25 milligram dose is really the optimal dose. So that's probably the dose that should be given in conjunction with the psilocybin and therapy. There's also been some studies comparing psilocybin with escitalopram or Lexapro, and again showing that psilocybin was equally effective or even more effective than escitalopram, an SSRI that's used to treat major depression. And the other thing too is that the study showed that psilocybin was safe, well tolerated, and really had few side effects. And that's the other kind of key takeaway point from these studies, is that these drugs, ecstasy, nowadays people think ecstasy, rave parties and people tripping and doing crazy stuff and getting in a lot of trouble. The thing is, when millennials and Gen Zers today are partying hard and doing ecstasy, you don't know if this is pure MDMA or if it's laced with fentanyl or heroin or God knows what. But I'm talking about in these clinical studies, pure MDMA, pure unadulterated MDMA. It's not contaminated or laced with anything. Same thing with psilocybin. It's not like, oh, you think it could be a magic mushroom and it's something else. Or, even the study with ayahuasca, it is what you're getting. It's not some contaminated, garbage that you don't know what you're ingesting. So, what these studies have shown is that unadulterated, pure MDMA, psilocybin, safe, causes, I'm not saying it's side effect free, but the side effects are pretty well tolerated. It didn't cause any like major increase in like suicidal ideation or psychosis, or causing these patients to become substance users or addicts. And again, these are precise, set kind of doses. This is not, you're doing it at the comfort of your own home and just taking whatever amount of magic mushrooms you want. This is, the administration of both MDMA and psilocybin, albeit, again, these are different studies, were all done in the office setting. This was not done in the comfort of your home. You were not doing 8 hours of psilocybin-assisted therapy or MDMA-assisted therapy through Zoom. This was in an office setting with trained clinicians. So that's the key thing. This is a pretty intense, structured, intensive treatment. This is not like, I'm just going to do whatever, like do some ecstasy today, but I won't do it tomorrow. And this is not something that's administered, indefinitely. So the one thing we're lacking with these studies is like, how long do you do this? What are the long-term effects? Because like in one of the psilocybin studies comparing the doses, patients were given in the comparative groups were given a dose on day one, and then they were given a second dose a week later, and then the effects were compared. So it wasn't like they were getting this every day for a month or two or 6 months or 12 months. Like when you take a prescription antidepressant, you're taking it every day for 6 months, 9 months, 12 months, or longer, depending on the situation. These are one-time doses, two-time doses, maybe 3 doses. This is not something you're getting every day. This is not something you're taking consistently. So one thing I will say is, like, we don't know, or we don't have enough of the data yet to know what are the long-term effects, a year later, 2 years later, 3 years later. At least in the short term, in the weeks, maybe a few months, that MDMA and psilocybin are effective in alleviating and the morbidity from PTSD and from treatment-resistant depression, and that these are very, very and potentially effective treatments for serious and debilitating mental health conditions, post-traumatic stress disorder. Again, people think it's just military people, but you could develop post-traumatic stress disorder from witnessing an accident on the news. I mean, who develops post-traumatic stress, who doesn't? There's no way of predicting, and why someone who witnesses something seems to go unscathed while another one is tormented. There's no easy explanation, but nonetheless, you open up the DSM and see the symptoms of PTSD. They're pretty debilitating, and right now, from a pharmacological perspective, we don't have in the psychiatric armamentarium anything that I could tell a patient with confidence, this is the drug of choice. This will treat all your symptoms. Often it's going to involve probably a combination of medications. So here comes along MDMA, and this, ecstasy, this party drug, might do the trick, might be able to treat these core symptoms of PTSD that is lacking right now. Psilocybin, treatment-resistant depression. Thank God we do have options. Ketamine, transcranial magnetic stimulation, electroconvulsive therapy. We do have some effective treatments, but in terms of an alternative drug that maybe you take 2, 3, 4 times over the course of a few weeks and potentially could have long-term therapeutic effects, that will be amazing, versus, okay, I have to take, an antidepressant for the rest of my life, or I have to do TMS, rounds of TMS maybe once a year, or have to do ECT, a couple times a year, or ketamine I may have to do indefinitely. So if, we have the emerging data that can show that a few dosings of MDMA or psilocybin can have long-term effects, that would be amazing. And the closest thing that I could say right now would be in TMS, there's a protocol. It's not FDA cleared, but there's a protocol where you do an intensive TMS in one day, and there's some case reports that show that even 6 months later, that one day of intensive TMS treatment still is durable and patients remained asymptomatic and in remission. So if we could have that with psilocybin and MDMA, that would be amazing, where you take a drug maybe a handful of times, maybe less than a half a dozen times over the course of a few weeks, and it could have long-term effects. That would be phenomenal. And thank God for President Trump. I'm not being political here, but him having the foresight of let's push the research more into addressing PTSD and making people aware of mental health and how important it is to treat chronic mental health conditions, that maybe this can lead into more burgeoning research into other psychedelic drugs that could address other mental health conditions. And on that note, I'm going to close today's talk. I'm Dr. Gil Lichtshine, aka Dr. Mensch. I want to wish everybody a good rest of your day and a great week. Thank you very much.
Thank you for joining us for Dr. Mensch with Dr. Gil Lichtshine, helping you navigate the world of mental health with clarity and care. If you or someone you love needs support, you're not alone. Treatment works and recovery is possible. To schedule a consultation or discuss non-medication therapies, personalized treatment plans, or psychiatric care, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. You can catch us each week on South Florida Oldies Radio and streaming across all social platforms. Until next time.